My root cause analysis is designed to answer the following three questions. First, what happened? Why did it happen? What can be done to prevent it from happening again? In the case scenario of Mr. Lara, the nurse administered an incorrect dose of regular insulin to a newly diagnosed diabetes patient during hospital stay in a medical surgical unit. The patient had a reaction of hypoglycemia that included sweating, shakiness, fast heart rate, and confusion due to the high dose of insulin prescribed by the physician. Second, why did it happen? The patient was a newly diagnosed diabetes type 2 patient and did not have any knowledge about insulin medication, neither the adequate dose of medication in his case. The nurse that administered the overdose of insulin did not double-check the dose with a second licensed nurse. Neither the nurse questioned the high dose of regular insulin with the doctor. Third, what can be done to prevent it from happening again? First, the nurse should always check with the patient when performing the blood sugar check how much of insulin dose the patient usually receives at home before preparing the medication for administration. And if the family is present, the nurse should also consult with the family. Second, if the patient is a newly diagnosed diabetes patient, the nurse should always make sure that the insulin dose is accordingly with the sliding scale from the blood sugar check. Third, if the nurse notices that the insulin dose is too high or seems out of the norm, always question the insulin dose with the doctor before administering it to the patient. And finally, the nurse always should have a second licensed nurse conduct an independent double check of the insulin dose before administering it to the patient. Thank you.